Aloha guys, it's Dr. Tom. I'm coming back at you. Yes, am I getting my recorder? Is my camera working? Can you see me? I haven't recorded a video in a while, and so I'm having a little bit of trouble with it today. But that's okay. All right, we're going to go over the reproductive systems, both the male and the female, and we're going to move fast and loose because we got a lot of stuff to cover. You can always go back and look and review my video and watch it again to get the highlights. Now we're just going to hit the high points, guys. We got it'll have to be at least a couple of videos because these are only 15 minutes long, and we got a lot to cover. So, all right, without further ado, we're going to start with the male. Well, in general, it says male, and then it goes right back to both of them. Okay, functions: produce, nurture, and transport ova and sperm, secrete hormones. The gonads, in males the testes, females the ovaries. The gametes are sperm cells in the male, eggs or cells or ova in the female. Male reproductive system produces, nourishes, and transports sperm. Deposits sperm within the female reproductive tract. Secretes hormones such as testosterone. Here's a cross-section of the male reproductive system. External genitalia, the penis, testes. Testes are suspended in the scrotal sac, and we'll go over some of these other in a minute. There's also some accessory glands and so forth. Testes, there's two of them. The reason they're in the scrotum is because they have to be maintained at a lower temperature than the body, and so that's why. Lobules, let's see. Sperm are produced in the seminiferous tubules. I don't know how to get that changed, guys, where it's not in my recording here. So I guess we'll have to live with it. Here's a sperm cell. Acrosome, the head, where the genetic material is. This produces fructose for energy. The only human cell that has a flagellum is the sperm cell. Now, something real important. In normal cells have 46 chromosomes. The egg in the sperm cell has 23, and the reason is once they fertilize and unite, 23 and 23 adds up to what? That's right, you got it, 46. So these sex cells have to undergo a second mitotic division, is called, and it's called meiosis. Meiosis is cell division without doubling the chromosome. So we end up with 23, which is what we want, see. Parts of the sperm, we went over that. Okay, produced in the seminiferous tubules, they go into the epididymis and through the spermatic cord. There's a long tube called the vas deferens. Here's the prostate gland, and then out the urethra. Seminal vesicles, here they are, produce 60% of semen's volume. Let me back up and add. Sperm are the cells. The liquid is contained in is called semen. Prostate gland, the urethra, the urethra does, but also these ducts and so forth go through the prostate gland, guys. And I've always been taught that the prostate's responsible for most of the semen's volume, but this makes it sound like the seminal vesicles are. Bulbar urethral glands, okay, form semen. Here's the pathway for sperm cells. I'll let you read over this. Male sexual response. Effects of testosterone, the primary male hormone. Now, females also have some testosterone too, guys. Big one, sperm development. Primary sex characteristics. What are the primary sex characteristics? They're the external genitalia. What are the secondary sex characteristics? Well, in the male, they're muscular development, voice deepens, facial hair, body, body hair, all that. Testosterone is what does all that. Thicker skin, male physique. Okay, two hormones from the hypothalamus. You've heard them before. FSH and LH, follicle stimulating hormone, luteinizing hormone, play an important role in the female, but they also play an important role in the male. It talks a little bit about it here. All right, pathological conditions. Hydrocele, where they get fluid buildup in the scrotum. The testes can get twisted around, which is called testicular torsion. Or you can have varicose veins there. It's just called varicales. I'm not sure exactly what the treatment would be for all of these. It would just depend. Now, this is one, I've taught this class, guys, a long time. And this is one that always gets me. It's not that it's because it's not serious, it's because it's rare. And to me, in an introductory course like this one, you need to talk about the more basic stuff, the stuff that you see a lot more of clinically. And this hypospadias, what it is, it's a birth defect where the urethra, the urinary meatus is here instead of here. Now, as you might imagine, I'm guessing that this could cause problems with your love life. This can be surgically corrected. I'm not making fun of it. I would have not put this up there because it's rare. And there's other things that would be more important to talk about. Okay, in middle-aged and older men, they often get an enlarged prostate. And it's called BPH. That's important to know. Benign prostatic hyperplasia. Now, that wouldn't be a problem except for the fact that the darn urethra runs right down through the prostate gland, and when it enlarges, it crimps it, makes it hard to urinate. It can actually get to the point where you can't urinate. Not good. So there's TURP, is transurethral resection of the prostate. They take this instrument, put it in there, here it is, and bore it out and make it bigger. This is a very common procedure, and I'm assuming it's not fun, but I'd say it gets good results. So TURP, you need to know that. Okay, female. Yeah, I know, we're moving fast. Produces eggs, secretes hormones, nurture and protect a developing baby during 9 months of pregnancy. Okay, now to me, I would introduce the aspects of the female anatomy first before I jump right into it, but they don't do it that way. Okay, so there's 2 ovaries. Those are the gonads in the female. Here's a drawing of one. FSH, follicle stimulating hormone, luteinizing hormone, play a very important role in the female. They do in the male too, but particularly in the female. Okay. Throughout the cycle, let me back up and say this. Female infants are born with the eggs that they're going to have throughout life. They develop in utero. But they don't start maturing and ovulating until puberty. So this is showing how it undergoes, and we'll go over these all here in a minute, some. And the point in which the egg is released out into the reproductive tract from the ovary is called ovulation. Now there's a gap here, guys. Here's the oviduct or fallopian tube. These little fingers are called fimbriae, and they help sweep this thing in there so it can go up and do its thing. It can also migrate out into the abdominal cavity, which can be a real problem. Varying hormones. Estrogen is the primary female hormone. There's more than one. Men have estrogen also. Promotes maturation of the eggs, makes a female look female. The secondary sex characteristic of the female is pubic hair, breast development, fat distribution, widening of the pelvis, menstruation. The other important female hormone is progesterone. Again, males have progesterone and estrogen, and females have testosterone, some. Helps maintain pregnancy, works with estrogen, establish menstrual cycle, prepares the breast for milk production, letdown after pregnancy. Not letdown, actually that's prolactin. Okay, the genital tract in the female basically are the 2 oviducts. I prefer oviduct to fallopian tube, but both of them are correct. Here's the uterus. Here's the vaginal canal. This is an anterior view. Here's a cross section. Here's the ovary, the oviducts, and the uterus in the female, the vaginal canal. Fimbriae sweep over into the tubes, not attached to the ovary. There is a space here. And like I said, the eggs in some conditions migrate out there, and then normally that wouldn't be a problem, guys, except these tissues are affected by monthly hormones. Endometriosis is the main one that you see that in. Okay, something important you may not know. Fertilization occurs in the oviduct. The sperm have to swim up there and fertilize it, and then they migrate down and implant into the uterine wall. Uterus, let's see, there's 3 parts to it. The myometrium is the thick muscular wall, And then here's where the fertilized ovum implants. The entrance to the uterus is called the cervix. You've all heard of that. Vagina, birth canal. Accommodates baby. Okay. Here's the ovaries, oviducts, uterus, vaginal canal. External genitalia in the female. Collectively, guys, this is called the vulva. Collectively, all this. The labium and so forth. So here's a gynecological view. Here's a cross section. Okay, to me, the hormonal control in the female reproductive cycle is pretty complicated. And of course, at one time, many years ago, I had it in great depth, and I don't work in that field, and I don't, I teach it, but I teach just the basics, and I don't recall a great deal of it. I'd have to go back and go over. But you, however, are learning it for the first time, so that means you better get in there and get it. Here's the lining of the endometrium of the uterus. Shows how the thickness of it varies throughout the monthly cycle. Why? Because every month, guys, it's getting it ready for the possibility of pregnancy. And if pregnancy doesn't occur, then it sloughs off as menstruation. And it's secreted out of the vaginal canal in what we call the period. Purpose is to mature an egg monthly for fertilizations. 2 cycles work together, the ovarian cycle and the uterine cycle. Now, what's that mean? Well, part of it takes place in the ovary, and part of it takes place in the uterus. It lasts 28 days or a month, basically. LH and FSH play a big role. It's fairly complicated. Here it shows the egg going through the monthly cycle, and it gets the follicle ruptures and ovulation occurs, and then that ruptured follicle becomes the corpus luteum and plays a role, a vital role in it. If in fact that pregnancy occurs, and here's the endometrial thickness. I don't know what's going on, guys. All right. I've had all kinds of trouble with this morning. I couldn't get the PowerPoint to download properly. I should scrap it instead of do it, but I'm a little bit overdue about doing this one. All right. Here's the ovarian function. Ultimately, it ovulates, it ruptures, and goes out. FSH, LH play an important role. So I'm having a hell of a time. And as you might imagine, Dr. Tom is not known to be a real patient, kind man. I'd like to put my fist through it, but of course I can't do that. No, I'm just kidding. Ha, ha, ha. Okay, here shows all that. We talked about this a moment ago. I'm trying to just change screens, and it goes like this. Once the follicle is ovulated, then the leftover becomes the corpus luteum, and it plays an important role. You guys, you're going to have to go back over this yourself. Why? Because we're about out of time. That's why. Here shows the thickening of the endometrium, which is the lining of the uterus. Corpus luteum, dead or alive? Well, if there's no fertilized ovum takes place, it's dead. But if there is, it's alive, and it secretes HCG, human chorionic gonadotropin hormone, which is what they check for in pregnancy. That's what a pregnancy test checks for. Fallopian tube, ectopic pregnancy. Sometimes, guys, a fertilized ovum gets stuck in the oviduct. It's a real problem. Pelvic inflammatory disease. All this is open. There's some open connections out into the abdominal cavity, which can play a role. Good. We're running out of time. Gynecological and breast, ovaries, ovarian carcinoma, ovarian cysts are quite common. Carcinoma, of course, is cancer. Pelvic inflammatory, we talked about that. Uterine fibroids are quite common, just benign tumors. And oftentimes the female has to have a hysterectomy because they can really be problematic. Okay, summary of it. Okay, we're going to have to stop. We're running out of time. Go over this yourself, guys, because I got to move on to something else. Okay, sorry for the problems. Dr. Tom is signing off right now.